All right, here we go. Here's the three phases of care. The three phases of care talks about a seamless system that can be utilized inside a chiropractor's office to introduce nutrition. Basically speaking, the three phases of care, the first phase is acute. It's usually for the first 72 hours. That's when somebody comes in and hurts themselves. The second phase is the repair phase. That repair phase can be between 6 and 8 weeks. That's where you're actually repairing connective tissue. Many people will actually opt out of fulfilling the entire phase 2 or repair phase because they're out of pain. So they figure they're out of pain, they're out of trouble, they're not there anymore, and the doctor loses the patient. That's a real problem because they'll re-injure themselves very easily next time, or much more easily because they haven't properly repaired. The next thing is the last phase, which is the wellness phase. The wellness phase is broken into two categories. It's past the repair phase, and it usually is ongoing, like ongoing chiropractic care. But an individual is either wellness without osteoarthritis or degeneration, or wellness with osteoarthritis and degeneration. If it's without osteoarthritis or degeneration in any of their discs, then you give them regular wellness essentials. If it's with osteoarthritis in their disc, then you may give them wellness essentials joint focus, which also contains some Caprex and EPA, DHA, and some glucosamine sulfate. So there's two paths on that third stage, with or without osteoarthritis or degeneration. Okay, so let's talk about the first phase. In the first phase, what we're talking about is the actual phase of injury, that first 72 hours. In that first 72-hour period of time, there's a couple things that are happening. The first thing that's happening is an individual is having pain. So to deal with the pain, you use Caprex. Caprex is simple because what Caprex does is it actually works with kinases inside the cell to be able to make sure that you express less prostaglandin E2 or PGE2, so therefore there's less inflammation and less pain. Really works well, and during this acute phase, you should probably be taking 2 tablets twice daily, maybe even as much, 2 tablets twice daily is fine. That's Caprex, regular Caprex. The next thing that happens besides pain and inflammation is you actually get swelling or water retention. In that case, you want to be able to increase the lymphatic drainage or the drainage of that area because you're building up water in that area due to the swelling. And the way to be able to do that is to be able to break down proteins which are sort of clogging the way from releasing that water. The way to break down those proteins and increase lymphatic drainage out of that area where the injury is happening is with proteolytic enzymes. Proteolytic enzymes are enzymes that break down protein. And the thing that's clogging up that draining from draining out that water from that injured area is proteins. So you need to break them down. It's almost like a stuffed up toilet bowl or a stuffed up tub. You need to sort of break down the things that are stuffing it up. And those proteolytic enzymes are found in protrypsin. Protrypsin specifically is taken at 3 to 4 tablets 3 times a day away from food, not with food, away from food. If you take it with food, it'll actually break down the food. We want it to get into the full circulation of the body and be active, so you take it away from food. 4 tablets 3 times a day away from food. The last thing that's happening during that acute phase is that you're dealing with muscle spasm. We want to be able to deal with muscle spasm effectively, so the 2 main ingredients in MyoCalm are very, very important, both calcium and magnesium. Calcium and magnesium help in regards to muscle relaxation and muscle contraction, so we want to make sure we have muscle relaxation and contraction being healthy so an individual can have relaxed muscles. In addition to that, it also contains valerian, and in addition to that, it also contains passiflora. And both those things tend to work on the central and motor nervous systems to be able to make sure you're not constantly sending messages of muscle spasm to that area. That'll help to calm you down so you have a better shot at it. Another insight in regards to the use of MyoCalm is MyoCalm can be used well past the acute phase. Because basically speaking, it helps to be able to relax the muscles, which are people many times when they go into have an adjustment, they guard their back or they guard the part of the body which is being adjusted because it's in pain. They're worried that it's going to hurt worse by getting the adjustment. This will actually relax those muscles so the chiropractor gets a better adjustment, more a crisp adjustment, and there's less guarding by the muscles. So that's another way you can use it, but we're using it in this context with that first acute phase. So remember, the 3 things you need are Caprex in the acute phase at 2 capsules twice daily. The second thing you need is protrypsin at 3 to 4 tablets 3 times daily away from food. And the third thing that you need is the Myocalm, and the Myocalm should be approximately one tablet per hour during the course of the day, regular Myocalm, especially in those first 72 hours. And that'll be really helpful. People really do very, very well with that. After they get past that first 72 hours, then they start getting into the repair phase. The collagen microfibrils, the collagen found in the tendons and ligaments and the actual joints themselves, start repairing after that first sort of inflammation phase, that acute phase, and that's known as the repair phase. It's 6 to 8 weeks. If a person only goes through like 2 or 3 weeks of that, then they don't repair well enough. I mean, imagine a situation, this is a good analogy to give to your practitioner, imagine a situation where you just broke your leg and the doctor just put a cast on, and you put the cast on and then 2 weeks later, well, it doesn't hurt anymore. Would you go and start stripping off your cast before the doctor told you to take it off? Of course not. The reason why is because you'd be worried that your leg wasn't healed enough to be able to walk on it properly. The same thing is found within most of these chiropractic situations where a person hurts themselves. They really haven't healed their connective tissue, that's tendons, ligaments, and joints, well enough to be able to really put pressure back on it and to be able to really put it through, agonizing types of motions that it went through before. To not get the adjustments and not have the nutraceuticals is sort of like taking the cast off of a broken leg. So it needs to be done for about 6 to 8 weeks. The actual nutrients, besides the chiropractic adjustments and home care, the nutrients involved with this would be things like collagenics. Collagenics is actually meant for tendons and ligaments, and it's also helpful in regards to cartilage as well, but mostly tendons and ligaments, because it helps what's known as collagen microfibrils. Those are those little wire-like substances that are found within tendons and ligaments and a little bit within cartilage that give it tensile strength, strength of pulling. So basically speaking, what we're dealing with here is we need to make collagen microfibrils. What are necessary to make collagen microfibrils? All the ingredients found in collagenics. There's specific amino acids in there. Now remember, how do you make a collagen microfibril? You make a collagen microfibril by first starting out and putting together proline, glycine, or cysteine. 3 of those 4 together, glycine's always one of them, and twisting them together like twister seals. And as you twist them together like twister seals, 3, it's known as a tropocollagen unit. And the thing that holds that twist together nice and tight are things like zinc and vitamin C. So those hold the twist together really tight. Excuse me, not zinc and vitamin C. It's silica that holds the twist together. That's what's known as a tropocollagen unit. And then they become what's known as hydroxylated or stacked one on top of each other. And that is with vitamin C, iron, and alpha-ketoglutarate form that stacking. When you end up with that stacking, you end up with something called hydroxylated tropocollagen unit. Or a collagen microfibril. And it's about the thickness of one of your hairs, but it'll actually hold 22 pounds in weight if it's properly nourished. And that's an important thing to be able to point out to your doctors. Proper nourishment allows it to have much more tensile strength. So basically speaking, that's what makes those collagen microfibrils, which are the major part of such things as tendons and ligaments. And you need collagenics. So collagenics during this repair period would be approximately 1 to 2 tablets 3 times daily, depending upon the severity of the damage. 1 to 2 tablets 3 times daily, or 3 to 6 a day. Best to take them away from food because they contain amino acids. You don't want them to compound with other amino acids or proteins in your food, so best away from food. The next thing that would be during this phase is to really start supporting the actual joints themselves or the cartilage. There's 2 different types of cartilage. There's articulating cartilage in joints and knees and shoulders and stuff like that. In your back, it's known as fibrocartilage. But either which way, it's supported by such things as glucosamine, chondroitin, MSM, which is sulfur, which helps the joint as well. And then things that work as minor anti-inflammatories, such as zinc, copper, and manganese. These are important factors as well. They're all found together in ChondroCare. ChondroCare, the dosage is 4 to 6 daily, so it's 2 twice daily to 3 twice daily, and you can take that with food. They should be taking that during this course. So it's the collagenics and the ChondroCare. So basically speaking, you have both of those things together in that phase 2. You could also be taking Caprex as well if you're discovering any pain in that area, but more than likely you only need 1 twice daily of Caprex. This brings us into the 3rd phase. After that 8-week period of time, they basically healed themselves, but we want to put them into wellness. If an individual has degenerated joints, you really can't reverse heavily degenerated joints, so you need to be able to maintain them. So you'll take them down the pathway of phase 3 of wellness, where there is degeneration in the joint. In that case, you'd use the Wellness Essentials Joint Focus, 1 packet twice daily. If they don't have any degeneration and they basically have gotten past their repair phase nicely, and they're going to wellness, then use regular Wellness Essentials. please do refer to the three phases of care sheets that you're going to be getting, the forms that you're going to be getting, as well as the brochures where the patients can be taught by the doctors all about three phases of care. And one of the benefits of three phases of care, which is important to understand, is most chiropractors, unfortunately out there, will lose patients somewhere in that repair phase because when they're out of pain, they're gone. They're not they're not being serviced by the practitioner because they think they're out of pain and they're out of trouble. So this really helps. This whole program and all the sheets and information really help the patient understand that they have to make it through that repair phase. Well, this was the three phases of care. I hope that was helpful, and we'll speak to you soon.